good day. I'm Bench Ligyab, Kapampangan International Fashion Designer. I'm one of the major sponsors of Mutya ng Pilipinas, Pampanga. Nalaman ko ang CSA Medical Aesthetics through Miss Weng Laflin. He mentioned me about it and then I'm so honored and blessed to have here. So andito na ako ngayon and I'm so excited to try their services. My concern here is, you know what, we are prone na sa mga puyat, ayan, sa trabaho ko. Hindi natin may iwasan yung medyo stress tayo and late na natutulog. So, I have, as Doc mentioned earlier, I have concern about my under eye na po. And then, my concern is my nose. Though sabi naman ni Doc is, I have a good nose, pero I really want to enhance my nose. So, you know what naman, ang nose is one of our focal point of our face. So, ito talagang una nakikita. So, I really want to enhance my nose. And medyo mataba siya dito. So, that's one of my concern to make it more higher.
Good day, everyone. Welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we have a new guest, a pride of Pampanga, or should I say pride of the Philippines, one of the famous national and international fashion designer. Let's all welcome Bench Ligyab.
Hi!
So, we're honored to have Bench with us. Like, I've been seeing him on the social media, Facebook, and I've seen his work. And they're amazing in terms of the fashion world, right? Say something about it. A little bit, Bench.
I'm Bench Ligyab, so I'm so honored and blessed to have you and so excited for our
Right.
procedure.
And congratulations for all those, like a lot of your
Thank you so much.
your clients are so happy with what they're wearing, especially in beauty pageants.
Yes,
right,
of
okay.
course.
Parang pangarap ko rin, no? Joke. Anyway, so we're here with Benj right now. We're so honored to have him. And then, actually, a while ago, I was doing already a so-called face mapping on Benj, okay? And looking at the upper third, middle third, lower third, of course, we wanted to do a so-called, like, making the face balanced and proportioned, okay? Actually, a concern also is in terms of the center of the face, which is, we say it's a center of attraction, our nose. Although I was looking at his nose, it's already beautiful and I could say it's a high nose, okay? For Bench would still wanna, like, you know, give it like a more highlight or further enhance, make it defined, and also like follow those length, those width. We can do that, okay? For those individuals who still wanna improve their looks and their nose, okay? Like, of course, Bench here, he kind of looks like a mix of like Caucasian Asian, right?
Yes.
Some people will think that you might be like, you originated probably from like Spanish or like even a mix of
Actually,
Asian, you know, Asian race, Chinese, okay? A little bit of that, okay? Because actually Filipinos are like a combination. We're called Pacific Islanders.
Yes.
Right? Okay, I look at his nose, the radix height, we can still improve that, and we wanted to follow a certain angle. Okay, Bench. We also like do measurements. If you're doing measurements on the body, you also do, like, for example, the height, the width, the length, okay, and also angles and proportion. So we want the radix height to be somehow within the angle of like a 115 to 130 degrees. Now for this one, we want it right angle 90 degrees, 95 degrees. And we also want to follow that intercanthal width. We can still do that. Actually, you already have a high nose, a good nose already. So a minimal enhancement. Then I'm also checking at the eye area of Bench, okay. I was noticing a while ago, like the under eye. So I think you're overworked, okay?
Yes,
so many projects that you're doing, then sometimes sleepless nights, okay? You're still thinking, you're still planning. okay, for the gown that you're making, okay. I noticed hollowness already under the eye area, volume loss under the eye, and sometimes you're noticing like fine lines and wrinkles under the eye area, right? And Bench is in his early 30s, right?
Yes.
And they say aging starts at 25. Before it was 35. Right now, they say aging starts at 25. So we have to do something to also delay aging process, okay? Science right now had made a lot of these discoveries and a lot of this advancement in terms of doing anti-aging treatments. So we want to do, of course, definition and beautification enhancement at the same time preventing aging. Kasi you're not that old eh. Diba? Bata ka pa. So we wanted to highlight beautiful features of the face and at the same time prevent aging, delay aging. Okay, what kind of treatment, what procedure, we'll show you when CSI Medical Aesthetics return. And we're back, so we're still with Bench. Okay, are you ready? So we're doing a non-surgical nose enhancement and at the same time an under eye improvement as well. Okay, so we'll start with the nose area, and we did like cleanse the skin and then apply topical numbing cream, and we'll also numb the entry point. So I'll be doing the so-called combination dermal filler plus our thread products. Okay, so this is lidocaine injected in the entry point area, which is actually like the infratip region or 5 mm inferior to the tip defining point, and like a tiny prick there. And I'll start with my hyaluronic dermal filler because I want volume specifically in the radix part. So I'm using a gauge 22 cannula. I'm just gonna glide it. Okay, helix lang. Then, some pressure. I only numbed the entry point with the injectable lidocaine because the filler also has lidocaine with it. So our dermal filler already contains lidocaine. So it will also numb the nose area. Okay. It's the first time for Bench. Sorry, Bench, ha? Virgin na virgin pa. Very first time to experience this, right? Okay. Yes. So I'm just gonna be pushing gradually, gently, my product material into the space like above the bone and cartilage into the bridge area. Okay, so actually the nose tissue, soft tissue layers, we have layer 1, 2, 3, 4, 5. Our layer 1 is the skin, layer 2 the superficial fat layer, layer 3 fibromuscular layer, layer 4 the deep fat layer, and layer 5 is the bone and cartilage area. So we are above bone and cartilage. I'm just doing this very slowly, okay, because I have inserted a gauge 22 cannula 50 mm length into the bridge region, and I need to reach the radix part. Okay. So we're like following a pattern or those kinds of angles and those ratios and proportions. So we wanted to somehow balance it with the entire face. Okay, so I'm just pushing slowly. So when I'm doing my filler injection into the nose, okay, so we want to be very gentle and at the same time pushing the product material gently. Okay, so I'm already gradually pulling out my cannula, and then after that I'll also be injecting dermal filler into the tip columella. So the columella has a space inside. We call it the intercrural space. Okay. So I can puncture again to make that entry point opened towards the columella. Okay. So I'll be using the same entry point bench has a long columella. Okay, some pressure only. Okay. I do understand like the sensation is kind of like some pricking sensation gently, okay, but it's a tolerable one. So a little bit into the base of the columella, or the so-called anterior nasal spine. I need to push it more there. Plus this has a lidocaine, so in a little while there's gonna be like a so-called numbing effect. So the lidocaine will also kick in. So we wanted to give bench a well-projected nasal tip. Okay, pushing like half mil of my product, and then I'll use my long PDO nose threads into the dorsum of the nose. So again, midline insertion, between layer 4 and 5, between the deep fat layer and the bony and cartilage layer. So it's just placing it midline and using this polydioxanone. You can also add like polycaprolactone. So polydioxanone hydrolyzes in 12 months. Your polycaprolactone can hydrolyze in 24 months. So these are different kinds of materials with different duration or hydrolysis. Okay. Now we'll also do the tip projection. I'll be using a shorter type of a thread here. This is a polycaprolactone type, and direct it into the anterior nasal spine, and there you go. So that's my non-surgical nose enhancement. Then let's do the under eye. So for the under eye right now, so bench is still young, okay, we just wanted to regenerate the skin under the eye and at the same time restore volume. I'll be using a product called Rejuran I, and Rejuran I is an injectable made up of the so-called polynucleotide. These are already DNA fragments that will help in regenerating our skin tissue, our skin cells, okay? So they will activate the fibroblasts, they will induce collagenesis, improve the dermis connective tissue matrix. Plus, it hydrates, it volumizes, it regenerates, it rejuvenates, it will revitalize the beautiful eyes of bench. Okay, there you go. So I have here specifically a Rejuran I, okay. In the past, we also used the so-called Rejuran Healer for the full face, and this one is specific for the so-called under eye area, okay. I'll be using two techniques, the cannula method as well as the needle method. So for my cannula, okay, I'll make an entry point. So this part here, I make a vertical line from the lateral canthus, and then this part here, you can make a horizontal line aligned to the alar groove area, and then a tiny prick there, just a tiny prick, okay. It's just like when you're having your acne facial, when they're doing acne pricking. And then I have here a cannula here. Actually, I use a smaller, shorter cannula for the under eye area, okay. So we'll just be injecting, pushing the Rejuran I. It's a polynucleotide substance. It's not a hyaluronic, okay. So this is already one of those under eye treatment that we use to regenerate the skin under the eye, okay. Before we were showing you dermal filler under eye, so not only hyaluronic can restore the skin condition under eye, also your polynucleotide molecules right now, because these are already DNA fragments that can help restore volume, hydrate the skin, brighten the skin, regenerate from within, because they're already helping our skin cells revitalize, okay. So restoring the vitality of the skin cells, okay. So I'll also do the other side, okay. So this is the cannula method, okay, pressure only here. We expect some pinpoint bleed from the entry point, so I'll proceed with the other side. So concern is volume loss, and at the same time some of the fine lines inferior eye area, okay. So again, entry point, tiny prick. I'm using a gauge 21 needle, okay, tiny prick only, bench, inhale, exhale, there you go. And then I'm gonna be pushing the the Rejuran I. So this is the cannula method. We ideally want to place this actually, okay, we want to target the dermal fibroblasts. Later on, I'll show you the needle method whereby I will be injecting it intradermally. So this is cannula method, placing it submuscularly, okay? So we also wanted to regenerate, at the same time volumize the sunken under eye. So the left side here, okay, just some pressure there. I'm using a very tiny cannula, okay? So this is up to the so-called tear trough region. Then I'll be leaving a 0.2 ml of my Rejuran I for my needle method, okay? So 0.2, okay, checking on the 0.2 already. So for the needle method, we're using the gauge 34 and it's 4 millimeter length, and we can use this for the intradermal approach. When it comes to the intradermal approach, we want to improve the infraorbital wrinkles, okay? So like 15 to 30 degree angle. So let's do some tension under the eye. You can just inject intradermally, and it's normal to create those so-called blebs or like wheel formation, okay? So if you want to correct the wrinkle in this under eye area, this is the method to apply. So we use the so-called bleb technique or point by point or serial puncture technique, okay? Just injecting intradermally into the fine lines below the eye, okay? So following those lines, okay? So we had two methods for Rejuran I, cannula method and our needle method. Again, this is gauge 34 with 4 millimeter length. Okay. Still good. Actually, this will also hydrate the skin and rejuvenate and stimulate collagen. Okay. So the polynucleotides are now the latest in terms of our injectables. Okay, you've been hearing about skin boosters, skin revitalization, improving the skin quality. Actually, right now, skin quality, skin tone, skin texture was reported to influence our perception of attractiveness. Okay, you have that good skin quality, good skin tone, balanced skin color or homogeneous skin color, then you have a very attractive face. Bench, that's our goal, attractiveness. Okay, so there you go. We've done non-surgical nose enhancement and Rejuran I injection under the eye. We'll show the result to Bench when CSA Medical Aesthetics return. And we're back, so we'll now show the results to Bench. And Bench, here's our mirror for you to inspect the result of our non-surgical procedure, nose enhancement plus under eye rejuvenation. So for the nose, we did combination dermal filler, hyaluronic substance, plus those PDO and polycaprolactone threads. We did the bridge elevation plus the tip columella projection. We haven't done yet the so-called ulnar bunching, but we'll see with this one with just the tip projection. And we also added the Rejuran I for under eye correction. We did the needle method as well as the cannula method. So Bench, how was it? Speechless.
It's speechless. Wait lang. Ayoko tumawa kasi.
Right. It's normal that initially we still feel some pressure or heaviness in the area. Okay, it's normal. I also had threads on the bridge area. The experience is like there's something on top of your face, or there's heaviness, there's pressure. And when you do also the tip columella projection, somehow you're feeling it in the upper gum region. That's normal when we do it. Then, like a day after, third day, it's gone already, okay? So we actually advise doing like cold compress for the first 24 hours, and we have some medications to prescribe, and then avoid heavy strenuous activities for the moment. And so far so good. And then we'll still do like a follow-up check on Bench, of course. So how are you?
I'm
far?
good. I'm good. And I see my face and my nose especially. It looks different. I mean, there's big
Right.
changes.
Exactly. So actually, you see an instant lifting, instant result, and well, this is still giving a natural outcome. You know, it's still you. And then like days or weeks later, you will still see some like remodeling, regeneration inside because the PDO threads, PCL threads are already under regenerative medicine whereby they can regenerate our tissues. Because in aging, we undergo the so-called degeneration of our tissues. So these kinds of procedures are already anti-aging. They will regenerate our soft tissues, our skin tissues, you know, to sustain that youthful look. So looking at the profile view, I can see a better angle, like the frontonasal angle, and then also on the nasolabial angle, it's like 95 degrees to 100 degrees, okay? So we had a good radix height already and somehow narrow the width without the ulnar bunching because we were able to project the nasal tip and we were able to bring out the columella as well, okay? And we'll be adding a treatment for bench. I noticed bench has this once, okay? Or the so-called glabellar wrinkles, we'll be doing also Botox. And then I recommended a fat reduction on the nose tip because I've noticed a while ago while we were doing it, I noticed some sebum coming out from the pores. So you still have active sebaceous glands. Teenager ka pa, active sebaceous glands. So we'll help them with fat reduction using our lipolytic injections or the nose mesotherapy, nose slimming. We'll be doing that for bench also. And the under eye region, I've noticed already an instant elevation of the sunken area. And we targeted the infraorbital wrinkles as well with our Rejuran I, and it will still regenerate. And like 4 weeks, 8 weeks, 12 weeks, we still have the collagenesis and the improvement of the skin texture as well as the skin quality. There you go. Thank you, Bench. Okay.
Thank you so much,
Yeah.
Doc.
It's. I know. It's your first time with injections like this, right? And you're kind of like speechless, but you're kind of like with the effect. Ooh, something like that. And the sharpness of the nose, actually it will still soften because we just injected it right now, okay? It will still kind of blend well. It will integrate inside, so it's still gonna subside a bit, okay? So this will still improve.
You know what? I'm so honored and blessed to have such like this procedure to me, and of course with the hands of Doctora. So super happy, and then it feels boosting my confidence and to meeting my clients, to meeting my friends.
Right.
And you know what? Lagi tayong puyat sa
Yeah,
trabaho,
exactly.
but at least thank you
Yeah.
for your
Welcome.
hands.
Welcome.
Thank you so much.
Yeah, there you go. Because even now, you know, like we're so overworked, over fatigued. We need treatments like this that will really boost our self-confidence. Even if I look at the mirror, okay, I feel like sometimes you have insecurities also, but at least we have these kinds of treatments that will kind of help us like feel better about ourselves, okay? And plus, of course, the injectors, the one who will perform your procedure, make sure they are well trained, licensed, and authorized to perform procedures like this. Thanks, Bench.
Thank you so much, Doc. Thank you.
Now, if you have any questions, you may email us at csaskinclinic@yahoo.com, our FB page, CSA Medical Aesthetics, Instagram, CSA Medical Aesthetics. Do you have like social media account that they could follow you?
Yes, I have a social media sa Facebook, Bench Legiab, and Instagram, Bench Legiab before.
Right, so if you need some, you know, gown,
Yes,
dresses.
if you're looking for a evening gown or wedding dresses, so you just message me on my page, Bench Legiab Couture.
Thank you, Bench. Okay. So our clinic is located here at the Infinity Shop, Pulong Maragul, Angeles City. Contact number 0933-860-9193 or 0917-504-4268. And please do watch our other videos in our YouTube channel, Contessa Salvador. So God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.